Today we're talking about lymphoma in dogs. The word chemo is quite a scary word. Now, not everyone wants to have chemo. That's okay, you know. It's quite a big thing to put your dog through and it's not for everyone. I get that. Okay, but for some people, getting 6 months, 12 months, 18 months, 2 years more from their beloved pet is really worthwhile and something that's very important to them. So, if you're interested in chemotherapy, we're now able to help you. We've started a cancer clinic at Treendale Pet Medical. So if you want what's best for your pet, try Treendale. So what is lymphoma? Lymphoma is a cancer of the immune system and specifically the lymphocytes. So can we cure lymphoma? Unfortunately, generally the answer is no. What happens is the dog will start a process of induction, and depending on which chemotherapy protocol you choose, which we'll come to in a moment, the animal will go into remission for a various length of time. Now, the unfortunate reality is that some microscopic cells will remain that will divide and repopulate the lymph nodes. So the cancer is going to come back at some stage, and then depending on the client's appetite for continuing, we can start the chemotherapy protocol again. So you'd probably like to know how long your dog's going to survive with lymphoma on chemotherapy. Great question. Well, it's going to depend a lot on which protocol you choose. Okay, so the absolute best protocol we can offer you is called a CHOP protocol, and we'll go over that in just a moment. But with the best one, induction goes for approximately 5 to 6 months, and then once your dog's in remission, the average is probably 6 to 8 months of life without chemotherapy. As we've just touched on, unfortunately the cancer is likely to come back. It's not an exact science, but on average 6 to 8 months later, we will have to make a decision whether we start the chemotherapy again. So we expect to get a 90 to 95% remission rate. Remission means the cancer goes away and your pet is chemotherapy free. So the average remission time is approximately 6 to 8 months. It's not uncommon for some dogs to get 9 to 10 months. Now the median survival time is approximately 1 year when followed by a rescue protocol. A rescue protocol means starting chemotherapy again. 25% of dogs will have a median survival time of 2 years, and a small percentage of dogs can survive even up to 3 years. So, you know, lymphoma is not necessarily a death sentence. There's several protocols that can be used to treat lymphoma and get some more valuable time with your pet. And you can have B-cell lymphoma or T-cell lymphoma. B-cell lymphomas historically respond better to chemotherapy, so it's important to differentiate between B-cell and T-cell lymphoma. T-cell lymphoma can be treated too, but it requires a different protocol. So which is the right protocol for you? Well, the good news is there's several choices. The bad news is that makes it totally overwhelming. If you do a search on Dr. Google, it's quite confusing, you're not quite sure what to do. The choice is sort of overwhelming. So that's the bad news. So essentially there's option A, B and C. So the absolute best protocol you can do is called a CHOP protocol, which is a multi-agent protocol. Essentially there's several different drugs that attack the cancer in slightly different ways. So you get the best results from the CHOP protocol. We use the one from the University of Wisconsin in the United States. It seems to be a very popular chemotherapy protocol, multi-agent chemotherapy protocol that's very popular with the best cancer specialists in the world, you know, so that's the one we would recommend. Your pet needs to come into the hospital initially every week. For the first 2 to 3 months, it's every week. We're going to pull some bloods and check particularly the neutrophil count, and there's going to be a different drug each week. After 2 to 3 months, we tend to skip a week and it becomes a fortnightly treatment. Okay, so it's a multi-agent chemotherapy that goes for approximately 5 to 6 months. The reason it's slightly variable is if the neutrophil count was a little bit low, we might skip a week and start again next week, right? So there's pretty much weekly trip to the hospital, blood test, your pet will have to be catheterised, and the chemotherapeutic agent will be administered, okay? So that is the best protocol, called a CHOP protocol. Now, there's a slightly less expensive way. There's a single agent protocol using doxorubicin, and for various reasons, sometimes that one's not appropriate, but it is a slightly more simple procedure. There's just 6 treatments, okay? Slightly less expense, not quite as good. Your pet will probably still go into remission, but perhaps for not quite as long. And there's an option C as well, which is much cheaper drugs, and it's a little bit more simple, okay? And the choice is really yours, different results, but if you want the absolute gold standard, it's called a CHOP protocol. So, do animals get side effects to chemotherapy? Remarkably, 80% of animals do not have side effects to chemotherapy. Sure, it can happen. The drugs, they're cytotoxic, they can have effects on the body. The most common one is a reduction in neutrophils. Neutrophils are part of your immune system. They help fight off infection. So before each dose of chemotherapy, it's very important that your dog has a blood test to check the neutrophil count. That's probably the most common side effect, is just a low neutrophil count, and exposes the pet to infection. So we need to check before each dose that the neutrophils aren't too low. If they are a bit low, we skip a week and wait till next week. So, thank you for watching. You want the best for your pet? Try Treendale.